Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Really important just to know what options we have in Pattaya for hospital care if we do not do our fast twitch muscle fibers and break a leg. So we're very lucky to, this is a wonderful, I haven't been there, but it's beautiful. I've driven past it and I've only heard really good things about it. So we're really lucky that Dr. Kasama or Miko is come to tell us about this wonderful new hospital, Pacific Garden. Big round of applause. There's a whole team here.
Good morning, everyone, and thank you so much for having me here today. Okay, I'm Kasama Wirojsakulchai, or you can call me Miko. I'm a doctor and a hospital director of Pacific Garden Hospital. Today, I'm gonna do something a little bit different. So there is a small card on each of the tables, and we have prepared 3 special prizes for you guys today. So if you want to enter, please write your name and nationality and your telephone number, and our team will collect your card and draws the winner after my talk. Okay, and sorry for my poor English, I'm very nervous here. Okay. I'd like to share something about my Pacific Garden Hospital a little bit. So we are at Baldwin, about 30 to 40 minutes from where we are right now. We are a new hospital, but our medical team behind us come from more than 30 years of experience. And we have 30 years of history in Bangkok in our group, which is called PRMG Medical Group. Okay. Okay, I have this, sorry. Okay, so before I show you what we can offer you guys, I want to talk about take a minute to talk about something here. So there are 4 challenges for healthcare for expats in Thailand here. One is the language barrier. So even though every hospital promised or advertises English services, it can be inconsistent. So one visit you can find a doctor that is fluent in English, and the other visit it can be someone who cannot converse in English language at all. So if you cannot convey your symptoms or your underlying disease clearly, how can you be sure that you receive an appropriate treatment? And the second problem is emergency uncertainty. So when something happens, it can be unclear or unsure which hospital to call, or it can be unclear if the person who answers your phone will answer in the language that you understand. So that uncertainty can be quite difficult as well. The third one is insurance complexity and pricing stress. So in most instances, many people end up doing their own paperwork and paying out of their pocket and also waiting for the refund. So that experience can be quite exhausting. Also for pricing stress, you cannot be sure if the price is the same for everyone, and the final number that you see on the bill can be uncomfortable. The last one is no care continuity. You might see different doctors for each visit, and you have to repeat and explain your history again and again. So if any of the problems sound familiar, that's why we are here today. Okay. So where does Pacific sit in that healthcare landscape here? Okay, so we usually see 2 extremes for healthcare for expats in Thailand. The first extreme is the large hospital. So it's well established, it has wide capabilities, but it's designed for volume, so not personalized. So which means it can mean long waits. When you want to make appointment for surgery, it needs long wait time. Secondly, it can mean premium pricing. you get more expensive than it necessary. And third one is complex process in insurance, in many decision maker, in any treatment plan. And also the experience can be less personalized. So this is one extreme that you might find in healthcare in Thailand. Okay. The other extreme is the small clinics, which is fine for minor issues, but usually it has limited diagnostic capability, no surgical capacity, and cannot handle emergencies. And also it has no structured follow-up. So that's the two extremes. So Pacific Garden try to fit in between these two extremes. So we have specialists on site 24/7. Even when we are 30 to 40 minutes away from Pattaya, we have transportation service for you. And also we have English-speaking coordination care, both in medical documents and in insurance claim. And last but not least, we have one price policy for no matter where you come from, no matter nationality, we have one price policy. Okay, so what you can expect from if you enter Pacific Garden Hospital, you can get these three things. The first one is fast access. So if you tell us beforehand when you enter the hospital, we try to not keep you in a queue. The second one is clear communication. So you will get English language communication for all of the process in both in verbal and in medical documents. And the third one is coordinated care. So we assign a dedicated coordinator for you all of the patient journey. Okay, so quick number about that is that we have 60 licensed beds. We open for 24/7 emergency department. We have 12 medical specialties, and we come from 30 plus years of group experience. Okay, so this is my father and mother. So my father is an obstetric gynecologist, and my mother is medicine doctor. So they are the one who found this PRMG Group. My mother is also specialized in wellness and regenerative medicine, which I will talk about later. So we are family-run hospital, which can sound traditional, but I think it might have something that you guys can appreciate. We are founder-led corporate. We are founder-led hospital, which means every problem can be tackled quickly. We can address problem right away. No need for 6 committees or regulations or anything. And we genuinely care about our patient because our family name is on the door. And this is the location of of the hospital. It's just 30 minutes away from where we are right now. And we can offer transportation service for you guys as well. Okay, so this is all of our medical service. So we have emergency department, we have orthopedics, cardiology and cath lab, general surgery, internal medicine, OBGYN, pediatrics, occupational medicine, wellness center, and aesthetics and plastic surgery, also pharmacy and physiotherapy and rehabilitation. We cover most of the service that general hospital give, but we focus deeply on 3 areas, which is orthopedics, cardiology, and wellness center, which I will talk in depth later in the later slide. Before I talk more about the 3 pillars that we focus on, I want to show you how it will feel if you stay in our hospital. So our hospital, we keep it quiet and less crowded than other bigger hospitals on purpose. So we have private rooms and calm environment, designed for rest and easy for family to visit. So if you stay in our hospital, we want you to feel like you are at our home, and we will treat you like our own family. Okay, the first pillar that we focus on is orthopedics. So common concerns of orthopedics include knee and joint pain, chronic back pain, falls at home, osteoporosis, and post-surgery mobility. So these are the kind of problems that if not get handled correctly, it can change someone's life from independent and active to dependent and losing your freedom. So we really focus on this service. So what our strength is that we cooperate with Rak Rayong Clinic. So we have subspecialist orthopedics on site with experience. Each of them has experience of more than 20 plus years. Okay, and and our doctor team cover all range of joints, including shoulder, hip, knee, ankle, wrist, and also spine. We give dedicated bone and joint surgery, including robotic-assisted surgery. We also offer arthroscopic and endoscopic surgery, which is minimally invasive approaches with smaller incision, less pain, and faster recovery. So that's what we can give. So for an active community like you, keeping your mobility is like keeping your life. So that's why this service matters to us. The next pillar is cardiology. So heart care is a long game. Heart care is a long game. It doesn't just mean the crisis moment. Usually and mostly it's about catching things early, treating chronic conditions well, and doing planned procedure with the right team at the right time. So that's what we focus on. So what's our capability? So we have specialist cardiologists on site, which our cardiologists come from Siligrit Hospital with more than 15 years of experience. We have cardiac catheterization lab in our hospital, and it's available 24/7 with physician on-call coverage outside business hours. So we can focus on annual cardiac screening, managing chronic condition, and we can do stenting and all kinds of cardiac procedures. So that's the second pillar. And the third pillar is wellness and regenerative medicine. What I want to convey here is that our wellness and regenerative medicine is very different from other hospitals in Thailand, because my mother, she studied under Dr. Hertog, who is leading names in bioidentical hormone therapy in Europe. And she is one of the only certified doctor in Thailand to use bioidentical hormone therapy. Okay, and moreover, she is the one who brings Dr. Hertog to train Thai physicians in his methodology in Thailand for 3 cohorts. For 3 cohorts now. Okay, so when I talk about wellness and regenerative medicine, our hospital, we cover hormone optimization. So we use bioidentical hormone therapy. We use regenerative medicine, also includes stem cell therapy as well. We have IV nutrient therapy and also comprehensive lab testing. So all hormone panel, all biomarker analysis we can do within our hospital. So when I talk about preventive medicine, I didn't mean just vitamins or multivitamin packs. I mean European trained, evidence-based, hospital-backed personalized medicine. That's what I talk about. So if you are 60 and you want to feel like you are 45, so maybe we can do something about it. Okay, and the other thing I want to touch this quickly is that we have English fluent doctor for you. We have dedicated coordinator, international, one have come to our talk today. So we have dedicated international patient coordinator who will bridge across all departments for you. Okay. And the other thing is we do international insurance insurance claim regularly, so we can handle this with no worries. Okay, we can do pre-authorization, direct billing where your insurance policy allows, we can do that, and also transparent pricing for all, same rate regardless of nationality. And this slide, we show you that if there is some instance that there is service that we cannot provide, there is care that we cannot provide, we can refer you to tertiary care. You can choose which tertiary care you want to go. And we didn't just drop you there. We provide language services. We prepare all the paperwork. We talk with the hospital that you're going to be sent to. So we don't just drop you there, just say good luck. No, we take care of you all the way until your recovery. This is just show that our hospital has quality and patient safety protocol. Okay, so that's all the service that I want to convey to you. Maybe next time I can go in depth and bring my doctor team to explain to you more about each diseases that you are worried about. You can. I want to support as much as possible. Okay, okay. So right now, if we have your names, we know you. We can give you dedicated patient coordinator. We can give you fast track registration. You don't have to sit in a queue. You come to our hospital, meet doctors right away, and no time wasting. Okay, and we can do insurance claim assistance and pre-book shuttle from Pattaya. And we gave you special price for every visit if you give us our name, okay? And our pricing is, we can talk about pricing later, okay? Okay, next. Okay, so I want to invite you, if you have the chance, if you can give us the chance to consider us to be one of the options in many good options in Thailand. I want to invite you to visit us, see the facilities, see the doctor teams, the real doctor teams. And if you come there, I will give you free consultation with orthopedics and cardiologists. No payment, no commitment, no anything. I just want you to come see my team and my place. Okay? I'm very nervous, sorry. And thank you, and if you consider us to be one of the options, I would really appreciate it. Okay, so thank you. So today I have Dr.
Yeah, come up. The team come up to the stage.
Maybe we can do question and answer.
Anybody also got a
draw winner together?
For the draw? Yep. I haven't had time to fill one in. I'm like stout.
Good morning. Let me introduce myself. I'm Dr. Thira Suriyawong, the medical director of this hospital, and I am a surgeon. You want more?
No. Morning, everybody, or afternoon, everybody, maybe. Panipa, you can call me. I'm pediatrician. Maybe you. อาจจะสงสัยว่าทำไมเรามาคิดว่าอะไรวะ
Maybe you wonder.
Maybe you wonder. I came here because I'm pediatrician who treat children, but I think expat is very, very cute. My officer told me about expat, and I wanna see that your community. My officer told that expat is very, very cute and very friendly. I wanna come here, so I am here, and nice to meet you all. Thank you.
Okay, thank you.
Any questions? Wait, we're going to have a draw in a second. Does anybody want to fill out a form and get it in the draw for a free echiogram? I think it is. Any questions and answers? Anyone?
Hi.
Oh, yep, one.
Excuse me. Thank you for the presentation. I wonder if you could tell us a little more about your heart imaging capability.
Can you repeat the question again?
Yes,
Sorry.
could you tell us more about your heart imaging capability?
Okay.
Perhaps maybe the calcium
Yeah, of course,
diagnosis and some other protocols, but your imaging capability.
Of course. First, if you have a cardio problem, you have to meet with our cardiologist first before we plan what treatment or screening is suitable for you. But we cover a variety range of cardio screening, including echocardiogram, exercise stress test, and calcium CT calcium scoring. So we can do that, and we can also do angiography if you want to know which vessel you need treatment. We can also do angiography as well. Thank you for the question. Thank you.
Thank you, Dr. Miko. I'm Dr. Davey. I'm a retired doctor from Australia. That was a great talk. It looks really comprehensive. I've got a couple of questions for people here. So, of course, somebody might have chest pain at home here in Pattaya or Jomtien or something, and or they might have terrible pain in their abdomen. So, do you have an ambulance, or what do you suggest if it's after? Do you suggest they come up to Bowen, to your hospital, or do you think, depending on the type of case or how bad it is, whether or not they should go to a closer hospital?
Yeah. As I open hospital and from experience, many patients didn't think that they have heart problem. They will come to our hospital and say they have abdominal pain, mostly upper abdominal pain, and they think it's nothing. They just want to go home. But when usually we want to be safe first and so we will screen for their heart problem immediately. For example, their cardiac marker, is it elevated? Their EKG, is it normal? So if there are any abnormalities, we advise that they need to be treated right away because it's dangerous if we let them go home. But for emergency, I think it would be best if you, but if you give a chance, I can let ambulance to to pick you up, of course. But if it's emergency, I recommend you go to a hospital near your home because I think it will be safer for cardiologist crisis problem. But for a chronic condition, for follow-up and for planned procedures, I can pick you up and give you service, no problem.
Thank you very much.
Does that answer your question?
That's great. Yeah. Thank you. Yeah.
Thank you. So you can ask any question. You can I can give you any health.
Doctor, thank you very
answer.
much for your presentation.
Of course.
It's an excellent presentation, and your English is excellent as well. Yeah, sorry. Thank you very much for your presentation. It's an excellent presentation, and please don't apologise about your English. It's very, very good.
Thank you.
My question is, you say 60 beds. On average, how many beds do you fill?
Right now, we are a new hospital, like I said, but our medical team has 30 years of experience. So right now, we only fill about 10 beds a day. So we can give you support, of course.
Oh, no, thank you. That was an idea. I just wanted to know what your fill rate was.
Okay, thank you.
Thank you, Good Eagle, for your talk.
Thank you so much.
It was very good for me, and I can, as a German, I can understand you much more easy than a native speaker. Thank you.
Oh, thank you.
Hi. Yeah, thanks for the presentation. My question actually is a general one in Pattaya because I've just had a couple of nights at the Pattaya Bangkok Hospital. But, you know, you see all the ambulances rushing around from different hospitals, but there seems to be no coordination between them. I think this is what maybe David was talking about. So if you are ill or something, it takes them a long time to come. There doesn't seem to be any actually ambulances that are based in Pattaya that can get to you within a few minutes, especially within the traffic. And you don't want to go to Banglamon Hospital or the Thai hospitals probably, because we want to go to the private ones. So there's all this, you know, who do you call? What number do you call? Is there a number that can coordinate all the different hospitals in Pattaya? There must be 6 or 12 hospitals here that will get you the right ambulance in the quickest time. Is there anything like that?
Okay. Oh, thank you for your question. It's a very, very good question. And I want to mention that I have a dedicated coordinator called Miss Yumi here today. And I will give you your phone number. It's up in the slides. And if you have any problem, any question to ask pertaining your health, you can call Miss Yumi and she will coordinate with our doctor teams, or if you want to go to a hospital near your home, we can also cooperate for you. So does that answer your question?
Basically, you want to find out the hospitals that are most geared around emergencies, because especially if you have a stroke, time is brain. So you really want to know, and they will be the first to put up their hand, and as she said very correctly, go to your nearest hospital that's geared around emergencies, right? So
of course.
Yeah.
That's of course okay if you've got a car or something, but you can't always get on the back of a motorbike if you're having a stroke or something to get to the nearest hospital. So my advice to you is if you can have an ambulance based in, I know it might waste somebody's time, and I'm based right in the centre of Pattaya or something, there might be a way of getting people quite quickly to a hospital or your hospital.
Okay, I can manage that. I will talk with my team first, and then I think I can manage. I can do that.
By the way, having been in an ambulance a couple of times, escorting my friend with a broken bone to and from the nursing home, they put the siren on when it's not an emergency. Believe me, right? He's only going for a checkup at the hospital from the nursing home, but they don't want to wait, so on goes the siren. I don't know that they allow that sort of thing in Australia, but hey, it works here.
Okay.
First of all, thank you all for coming. It was a wonderful presentation.
Thank you for having us here.
I was curious about the shuttle transportation you mentioned.
Okay.
Is that just for regular appointments? How is all that handled?
Okay, so mostly we prefer that it's booked shuttle service. So you have to call our coordinator first. So we prepare the shuttle bus for you. But if it's emergency and you really need the ambulance or the car, we can prepare the service within the day that you call. We can, but mostly we prefer that you book beforehand. Okay. So.
John, what a surprise.
Yeah, very interesting, certainly about the coordination, because like Mike was saying, you get this and then a different hospital and there's no coordination. But the question I'd like to ask is, you appear to me basically centre on cardiology and orthopedics. That's correct?
Yes.
We have other parts of the body.
Pardon?
We have other parts of our body.
Oh, I understand.
Yeah. Ear, nose and throat.
Mm-hmm.
We all get those problems. And Optimist Surgical. You know?
Yeah. Mm-hmm.
You don't do that. You don't cover that.
Right now, we have the service, most of the service cover for general hospital. So general surgery, he's a surgeon, so he can do every laparoscopic, endoscopic surgical procedure for cholecystectomy, for example, vasectomy, for example. And we are planning that next year we are gonna expand our services. Okay, maybe, but for what you asked about stroke, we can, right now we can handle stroke, but I don't include stroke in this slide because I think from Pattaya to our hospital, I think it's quite, there is a distance there. And if it's emergency condition, I would recommend you to go to a hospital near your home, I think.
Yeah, seeing your presentation, you have a free. Now, is that a free consultation when you become a member, or is it before?
When you become a member. So, but if you give us your name, you're already a member. I already know your name, your contact number. So, if you call our coordinator, it's like you're already a member here.
Oh,
of course.
Last one.
Thank you indeed for your presentation. It was very good. My question is, if you're already receiving treatment and advice from an existing hospital in the area and you want to swap to your hospital, what do you do?
Thank you. What would I do? Okay.
What do I do?
Yeah, what should you do?
Yeah.
You don't have to do anything. You just tell us which hospital you go in the past, and then our coordinator, our nursing team will cooperate with that hospital and get your medical history, get your medical documents, no problem.
And can I find out how the charges would differ? Because I actually pay for my own treatment. How can I find out the cost with your hospital compared with my own?
Oh, okay. You can ask. So if you have any symptoms you want to discuss with my hospital to know the expense before getting into the hospital, you can ask the coordinator, and then she will ask the doctor team what's the possible treatment plan's gonna be, how much the expense gonna be, and then she and the nurse team will call together to you and explain clearly how the treatment plan gonna be, how the expense gonna cost from, it's gonna be arranged, because we cannot no, we cannot know exactly what complication you have in your body before you enter our hospital. So the team will tell you the range of prices that's gonna be from the normal case to the worst case possible, and tell you all the treatment plan possible before you make the decision.
Yeah, my present hospital, I pay for blood tests, I pay for medication, but I don't pay anything for the doctor. The doctor is free of charge. Are your doctors free of charge?
Doctor fee, the hospital fee.
He's talking about Queen's Surrogate, which is a different kettle of fish to most hospitals. So, yeah.
Doctors free of charge. We can arrange that in special situations. We can talk about that. We can arrange that if it's possible, because I want to tell you guys, we have a Burmese expat getting to receive service of us at our hospital, and they don't have money. They don't have money, but they need emergency treatment. They have motorcycle accident, and I told my team that no need to talk about money. Help them first. We can talk about money later. So money is not the priority of our service here. So if thank you.
Can I just butt in there? These are not two young Thai Myanmar boys, are they? two young Myanmar boys?
Yeah, they are teenagers.
Rose knows all about them. I'm all up to date. You want to hear about them? I can tell you about them. So yeah, I hear about these stories. My partner's Burmese.
Like I said, we are family-run hospital. So every decision for pricing, for treatment plan, for helping anybody, it's easy to make decision because I am founder daughter. Okay, I'm not founder. I'm founder's daughter. So I can make decision pretty quickly. If you need any, it's not like Bangkok, Pattaya. The director there cannot make any decision. They are afraid of anything in their company. But I'm not afraid of that. I'm the founder, so I can give you any price. I can give you any treatment. I can explain anything to you. That's what I'm trying to convey. Thank you.
Well, and now the most exciting part of the whole morning. Are you going to win? Three prizes.
Okay. So the first one is called Siri Matsi. Oh!
Hey, Sally won something. Yay!
Okay. So this special prize, I give you the heart health checkup program. So okay, you can see the detail later. Okay. Maybe you can come มาเยี่ยมโรงพยาบาลเรานะครับ visit our hospital. Thank you so much.
And the second, get out of the way. Second big winner is
Alan Bryan from Canada.
Alan Bryan from Canada.
Yeah, congrats to you.
Thank you.
Thank you so much. It's a gift voucher for my hospital.
Oh, okay.
Yeah.
Thank you.
Thank you so much.
And the third big winner is, drum roll,
Mr. Stephen Kenya, British. Oh!
Hey! And this one is free, so you don't have to ask the price, okay?
This is also a heart health checkup. Okay. If you come, you can call my coordinator.
Okay,
and I will
thank you.
Okay, we have one last prize. Okay, for the next one. Mini prize. Okay.
Oh, okay.
Dr. Ren.
Is there a Dr. Ren?
Oh. So you get another thermos.
Okay, I will swap you, okay? Oh, wait a minute, I'll show the prize.
Thank you. Thank you so much.
Before you leave the stage, we do have a very small token of our deep appreciation. Thank you so much.
Thank you so much for having us here.
Thank you so much, Dr. Miko and the team. Thank you.